Y'all know me, I'm Dr. B, and this is The Buzz on Laryngomalacia. We've had a couple babies visit us recently for noisy breathing. One of the most common and scary reasons for noisy breathing in the newborn period and in the first several months of life is called laryngomalacia. Laryngomalacia. If you feel your own airway here, it feels kind of firm and hard. Well, that's cartilage in your airway around your voice box that keeps it open. Now, on some babies, unfortunately, that cartilage is maybe not thick enough or it's not hard enough. It's a temporary problem. But when those babies breathe in quickly, the airway can collapse because the cartilage is not hard enough to keep it open. When they do that, they make a noise called stridor, and it sounds something like this. Now, when you have a floppy airway and you breathe in quickly and you make that noise, that stridorous noise, then we call the situation laryngomalacia. Here's a drawing of the voice box. The important bits in this are the structure called the epiglottis up top. The epiglottis is a firm flap of tissue that's supposed to clamp over the airway and close it off when you're swallowing to keep food from going into the lungs. And the vocal cords, which are those two white lines of tissue along the sides. In a child with laryngomalacia, like the child on the right, you can see how the structure doesn't look strong enough. It looks kind of floppy and wiggly. It's not firm and tight like the normal picture on the left. Also, that floppy epiglottis can often become curved and shaped like a Greek letter omega. And here you can see an actual photo of a floppy omega-shaped epiglottis. What a sentence that is, a floppy omega-shaped epiglottis. But that's what you see when you look down in there. If you have an ENT who takes a look, that's what they're going to see. And when that child breathes fast, that floppy omega-shaped epiglottis is going to flop down over the airway and cause that awful stridorous noise. So that is what we're dealing with. We usually notice this stridorous sound in the first few weeks of life. The stridor is worse when the baby is feeding or crying or surprised or excited. They can be super happy and just making this terrible sound. And that's when air is going to be moving quickly through the larynx, especially when they're breathing in, and it can make that airway collapse. It can also be worse when the baby is lying on their back because gravity can help make that airway narrower. And the noise usually goes away if the baby calms down or is placed on their stomach. Now, as terrible as this sound may be, and let's hear it one more time. As terrible as that sounds, it's not usually dangerous. Of course, there are some bad cases of stridor, bad cases of laryngomalacia, where that airway is collapsing. It's making it difficult for the baby to sleep comfortably. It's making it difficult for them to eat without making this kind of noise, and the parents are just really panicked. What I tell people is, if all your child is doing is making this noise and they don't look bad, they should be fine. So I tell people, block your ears for a second, take a look at the baby. How do they look? Do they look like they're actually having distress? Do they look like they're thinking about breathing? Are they having trouble sleeping? Are they having trouble eating? The answer is no, and it's just a noise they make when they're excited, and it's probably not something that we need to get too worried about, and we just observe that, and in time it should get better. Now, what are some other causes of stridorous breathing in babies? Croup. If you see episode 9, that'll tell you all about croup and other infections of the airway. The difference here is that croup and infections of the airway are usually acute. They're short-term, they're episodic, they're not usually right from birth. Whereas laryngomalacia is going to be chronic. It's going to start after a week or two, and it's just going to keep going. It's over a very long period of time. So if your child is 6 months old and suddenly they have this stridorous noise, it's probably an infection rather than something that they were born with. Foreign body in the airway, again, rapid onset in a child who's never made this sound before. Usually this is going to be a little older kid, someone who's crawling around, might have picked something up off the floor and unfortunately has gotten that into their airway. Reflux can sometimes cause some stridorous sounds, and sometimes kids with laryngomalacia will have worse reflux. So this is definitely something we need to get a good history on and see if they're having reflux symptoms, see if we need to treat reflux as well. There are also some structural problems that narrow the airway. Vocal cords can be paralyzed. That can make stridorous a rough sounding voice, something called subglottic stenosis, laryngeal webs, vascular rings. These are things that we get into as we evaluate this. Make sure there's not some kind of structural thing that is narrowing the airway and causing there to be a problem where the air is not coming in and out. But these are things that will cause very chronic stridor, just like laryngomalacia, but they're probably going to cause a lot of respiratory distress or recurrent lung infections. And these will usually not get better until something's done about them. So if the stridor is not getting better, we may have to have an ear, nose, and throat doctor get involved and look down there and make sure that one of these other structural problems is not involved. Laryngomalacia is much more common than these, and it's not usually as bad as these, so don't get too worried about them at this point. Laryngomalacia almost always resolves on its own. So patience is key. Observation and reassurance is usually what we're going to talk about in the office. Keeping a close eye on the baby, make sure they're not having trouble breathing or trouble eating. Usually this goes away in the first year, maybe as little as 7 to 8 months. However, in worst cases, it can take a couple years to go away. My twins, who are now in their late 20s, had this problem. And I'll tell you, when you have two kids making this noise, I'm with you. It is a scary noise, and it is something that you want to go away right away. You have to be patient, make sure they're not having trouble breathing or trouble eating, and in time it will go away. There is one situation that I want to talk about, and that is taking a moment to talk about reflux. Laryngomalacia and reflux often go hand in hand, and making the reflux better will often help with the feeding and the stridor during feeding. So let's discuss just for a minute how to manage reflux at home. The first thing you can do is prop the baby up when feeding. Make sure that gravity is helping the food go down and stay down and not come back up. Smaller, more frequent feeds are a better idea than doing less frequent large feeds. The baby's less likely to spit up if the feeds are small and more frequent. Stopping the burp more frequently. Thickening feeds if necessary by using rice cereal. And medications. If none of these things are working, you may want to look at using a medication to make sure the reflux is better. The last two things, thickening feeds and medications, please talk to your doctor or give me a call and we can talk about how we want to handle those. In summary, laryngomalacia is usually a benign problem, even though it sounds very scary. Now, if your child has trouble breathing or sleeping or eating, or if they're having apnea spells, maybe they're pausing their breathing too long, longer than we want them to. If that happens, then we would have you see an ENT and make sure there's not something more serious going on. But even if they do go to see an ENT, surgery for this problem is extremely unlikely. So don't worry too much about it. We'll talk to you in the office about these problems. Well, y'all know me. I'm Dr. B, and this has been The Buzz on Parenting and Pediatrics. If you saw something that might have helped you, please subscribe and share with your friends, and we'll see you next time.